Hello, I'm Sean Puype, President of Advantage Allergy Services, and welcome to our model for allergy services in a health system setting. You may already have allergy services, so let's see if we could improve on that. Why the current system fails the patient and the providers. Under each tab, such as patient, primary care, specialist, hospital urgent care, and insurer, we have identified some of the issues and problems associated to the current system. Under the current service model, you could see that the primary care physician refers to the specialist, or in this case, most patients just going straight to the ER is becoming very expensive. What needs to happen is a comprehensive system that addresses this at all levels under a healthcare system. Details for Stage 1 development, the healthcare uses the Advantage Allergy System for all of their needs. The patient's needs are met. The primary care becomes the gatekeeper. The specialist gets referrals from the primary care, and the hospital care visits are limited and now referred back to the primary care as the gatekeeper. Primary care is now the gatekeeper. Keys to success are lowering the cost to the service line. Specialists include now EMTs and pulmonologists. ER and urgent care visits track and bring back to the primary care as the gatekeeper. These potential patients now are in our care system. Insurance participants in managed healthcare. This slide demonstrates the continuity of the health system, driving everything back to the gatekeeper. Our primary care, our pediatrics, and our specialists now being the allergists, EMTs, and pulmonologists. For the ER and urgent cares, everything is driven back to the gatekeeper so you could reduce costs. Let's take a look at a sample revenue scenario. In this scenario, we have 200 practitioners seeing 1 to 2 patients a week for allergies and asthma control. As you can see, this is a minimum number, and look at the revenue that's generated by having an entire system in your health system. Stage 2 of development includes alternative methods, such as mobile units targeting demographics that are unusual for treatment or difficult for those patients for treatment, and community charity corporate sponsorship. Things like city planners, corporate sponsorships, charities all drive our costs down. By utilizing alternative methods, urgent care for compliancy, independent school district locations, mobile units, corporate wellness, and then having the corporate sponsorship campaigning and the community involvement, the health system will thrive in a positive image and campaign. By using Advantage Allergy Services in your entire system, your footprint is increased for allergy services and asthma control in your community. You have a foothold in that community that is a positive image for your health system. Take a quick look at the stages for development. You have the traditional model currently that has some of its failures. We have Stage 1 that includes bringing Advantage's allergy services into your entire health system and combining the efforts later on with Stage 2 that has the corporate wellness, the group community services, as well as the alternative methods included. This was a quick little overview of our health system model. Please look at the printed material, and if you have any questions, we'd like to address those. Anytime you'd like to speak to us on this issue, we'd sure appreciate it. Thank you for your time and effort, and have a great day.